If you like psychology content, subscribe to Psychology in Minutes for more. Have you ever left the house, locked the door, walked away, and suddenly wondered, did I really lock it? Most people check once and move on. But imagine checking 20 times, taking photos for proof, and still feeling uncertain. That's the reality of obsessive-compulsive disorder. Today, we're diving deep into OCD and answering one of the most common questions. If people with OCD know their fears are irrational, why can't they just stop? Because OCD is not a logic problem, it's an anxiety disorder. OCD consists of two main components: obsessions and compulsions. Obsessions are intrusive, unwanted thoughts, images, or urges that cause intense anxiety. Compulsions are repetitive behaviors or mental rituals performed to reduce that anxiety. The relief is temporary, which reinforces the cycle. Common obsessions include fears of contamination, harming others, making mistakes, losing control, blasphemous thoughts, sexual intrusive thoughts, or an overwhelming need for symmetry. Compulsions can include hand-washing, checking, counting, arranging, repeating phrases mentally, seeking reassurance, or avoiding triggering situations. For example, someone may fear they accidentally hit a pedestrian while driving. They know it's unlikely, yet they may drive back repeatedly to check. Another person may wash their hands until their skin cracks because the anxiety feels unbearable. It's important to understand that OCD is not simply being neat or organized. Many people with OCD suffer silently from pure O, where compulsions happen mentally through rumination, praying, or internal checking. Symptoms can consume hours each day. They can interfere with work, relationships, and basic functioning. People often feel ashamed, especially when obsessions involve taboo topics. But intrusive thoughts do not reflect character or intention. They reflect anxiety. Research suggests OCD involves abnormalities in brain circuits connecting the orbitofrontal cortex, anterior cingulate cortex, and basal ganglia. Genetics also play a significant role. Stress can worsen symptoms, but it does not cause OCD by itself. Now the burning question, why can't they just stop? Because compulsions provide immediate relief. The brain learns that rituals reduce anxiety, even though they strengthen OCD long-term. It's like scratching a mosquito bite. It feels better temporarily, but makes it worse over time. The most effective treatment is exposure and response prevention, or ERP. ERP involves gradually confronting feared situations while resisting compulsions. For example, touching a doorknob and not washing immediately afterward. Over time, the brain learns that anxiety naturally decreases on its own. Selective serotonin reuptake inhibitors, prescribed by a psychiatrist, can also be highly effective. Lifestyle strategies help too. Regular exercise reduces anxiety. Adequate sleep improves emotional regulation. Mindfulness teaches people to observe thoughts without reacting. Support from loved ones is crucial. Avoid participating in compulsions or offering endless reassurance. Instead, encourage treatment and celebrate progress. Say, "I know this is hard, and I believe you can handle the discomfort." OCD attacks what you value most. Recovery means learning that thoughts are not threats, and you are always bigger than your fears.